A lot of children and adults worldwide suffer from different types of rare diseases, some of which could be really horrifying. If you're interested in knowing more about medical facts, rare conditions, and stuff like that, I think my channel would be up your alley. Hello guys, welcome to my new video in which another horrifying rare medical condition is described. Holoprosencephaly (HPE) is a relatively common birth defect of the brain, which often can also affect facial features, including closely spaced eyes, small head size, and sometimes clefts of the lip and roof of the mouth, as well as other birth defects. Cyclopia, named after the Greek mythology character Cyclopes, who are giant one-eyed creatures, is the most extreme form of holoprosencephaly and is a congenital disorder characterized by the failure of the embryonic prosencephalon to properly divide the orbits of the eye into two cavities. It means the forebrain of the embryo doesn't form two equal hemispheres. The forebrain is supposed to contain both cerebral hemispheres, the thalamus and the hypothalamus. The most obvious symptom of cyclopia is a single eye or a partially divided eye. A baby with cyclopia usually has no nose, but a nose-like growth sometimes develops above the eye while the baby is in gestation. Cyclopia often results in a miscarriage or stillbirth. Survival after birth is usually a matter of hours only. This condition isn't compatible with life. It isn't simply that a baby has one eye. It's a malformation of the baby's brain early in the pregnancy. Cyclopia, also known as lobar holoprosencephaly, occurs in about 1 in 100,000 newborns, trusted source including stillbirth. A form of the disease also exists in animals. There is no way to prevent the condition and there is currently no cure. What causes it? The causes of cyclopia aren't well understood. Researchers believe that several factors may raise the risk of cyclopia and other forms of holoprosencephaly. One possible risk factor is gestational diabetes.
Gestational diabetes. 9 out of every 100 pregnant women will develop the condition, and having a family member with diabetes or one who had a baby over 9 pounds just increases your risk, and that risk continues beyond delivery.
In the past, there had been speculation that exposure to chemicals or toxins might be to blame, but there doesn't appear to be any correlation between a mother exposure to dangerous chemicals and a higher risk of cyclopia. For about 1/3 of babies with cyclopia or other kind of holoprosencephaly, the cause is identified as an abnormality with their chromosomes. In particular, holoprosencephaly is more common when there are 3 copies of chromosome 13. However, other chromosome abnormalities have been identified as possible causes too. For some babies with cyclopia, the cause is identified as a change with a particular gene. These changes cause the genes and the proteins to act differently, which affects brain formation. In many cases, though, no cause is found. Some of the risk factors increasing the probability of cyclopia include previous miscarriages, drugs during pregnancy, for example, alcohol, aspirin, lithium, hormones, anti-cancer agents, and fertility drugs, ultraviolet light, consanguineous marriages, marrying from the same ancestry, exposure to insulin during pregnancy, gestational diabetes, exposure to an alkaloid poison called cyclopamine. How and when is it diagnosed? Cyclopia can sometimes be diagnosed using an ultrasound while the baby is still in the womb. The condition develops between the 3rd and 4th weeks of gestation. An ultrasound of the fetus after this time can often reveal obvious signs of cyclopia or other forms of holoprosencephaly. In addition to a single eye, abnormal formations of the brain and internal organs may be visible with an ultrasound. When an ultrasound detects an abnormality but is unable to present a clear image, a doctor may recommend a fetal MRI. Both an ultrasound and MRI pose no risk to the mother or child. If cyclopia isn't diagnosed in the womb, it can be identified with a visual examination of the baby at birth. Outcomes of cyclopia. In some cases, cyclopia and holoprosencephaly are present along with other genetic syndromes that cause additional issues as the embryo develops. Unfortunately, cyclopia results in such severe physical problems that it is incompatible with life. Most babies with the condition are stillborn or pass away shortly after birth. There are no cases of babies with cyclopia living more than 6 months after birth. A significant number of babies born with cyclopia may also have malformations of their chromosomes. Cyclopia can be inherited. If your baby has cyclopia, inform your immediate family members who may also be starting their families. It is essential to tell them of any other minor forms of holoprosencephaly. Genetic testing is very useful in determining the risks of children being born with inherited diseases. Thank you guys for watching the video.